Even as top administration officials were answering questions at the White House about the federal response to Ebola, much of this day's attention was focused on the latest developments in Texas. Sreenivasan has the story.
A hazardous materials team arrived this morning at the Dallas apartment complex where Thomas Duncan stayed before being hospitalized on Sunday. They collected anything contaminated, including a car that they covered with a giant plastic bag. The Dallas fire marshal said 4 of Duncan's relatives are being moved from the apartment complex to new accommodations. They'd been quarantined under armed guard after they refused to remain inside voluntarily.
Nobody is supposed to go inside the apartment. They are in their apartment. They cannot come out. They are not even allowed to come on the porch.
Dallas County Judge Clay Jenkins, the county's top administrator, voiced concern for the family's plight and apologized for the delay in removing the soiled items. Meanwhile, Texas health officials said they've narrowed the group being monitored to 50 people who had direct or indirect contact with Duncan. Crews have also cleaned schools attended by 5 students who were exposed to Duncan. But some parents say they're far from reassured.
We just got letters in the kids' backpack yesterday saying that they have it basically under control, but I feel, otherwise, because if you really had it under control, the kid wouldn't have came to school in the first place, but you'll never know.
As for Duncan himself, questions continue to swirl over the handling of his case. He managed to fly out of Liberia last month after having contact with an Ebola patient. He showed no symptoms at the time. But after falling ill in Dallas, he was initially turned away by Texas Health Presbyterian Hospital. The hospital blames a flaw in its electronic record system. Duncan was admitted on Sunday, but even then, his nephew complained that Duncan was mishandled. At the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci says he agrees.
The idea that this person went to an emergency room and they did not flag that he had recently been in Liberia and thus immediately put him in isolation was unfortunate that that was missed. That happens. I think the important thing is to have that as a lesson learned to look forward.
Infected hospital waste has also become an issue. Dallas officials announced today a disposal company is now in place.